Hey angels, we're so excited to show you this new YouTube video of a dermaplane. First and foremost, please hit that subscribe button so that way you're notified whenever we upload these really awesome videos for you. If you want to know more about our facials and aesthetics life, make sure you definitely subscribe. That being said, today we're going to do more of like an interview style with Sam, since she's our dermaplane queen.
Hey girl, hey.
I'm gonna just basically come up with some questions that are very common in our comment sections with all of our videos. I would say the first one that we get is, will your hair grow back differently? Will it be a different color? Will it grow back faster?
Very common question. Very common, even in the treatment room. It does not change your hair. I cannot change your hair by dermaplaning it. You can't change your hair by shaving. Something has to happen internally. And for those, that get thicker hair because they start shaving, we all have heard that from grandma and grandpa and aunt and mom, is because something is happening internally. Boys become men. That's why their hair gets thicker. So it's not going to change the hair.
Love it. How often do you recommend getting this treatment, especially for someone, who has a lot more hair than others?
I think that really can be kind of personal preference. I have plenty of patients that like to come in every 3 weeks. Average is about once a month. So it really depends on your personal preference. I would not do it more than twice a week, or every 2 weeks. But doing it every 3 weeks, I think you can swing it for some people. And your esthetician will be able to guide you. They'll be able to tell you what your skin can tolerate. So you really need to listen to your skin specialist.
Perfect. Is this a treatment that you can pair with other treatments at the same appointment?
Sometimes. It does depend on what you have done with this patient before. You need to be familiar with this person and their skin. You do not want to overdo it, especially with skin of color. If you overdo things with their skin, you risk causing pigment, and that is not something that you want to do to your patient. So sometimes less can be more. When I have a new patient and they want to do a dermaplane, I will just do that by itself first. I want to see how they do, how they react. I'll see them again in a month, and maybe I'll pair it with something else depending on how they did with that one.
Yay. What kind of schooling do you have to have, or do, in order to do this kind of treatment on a patient? Or how many hours should you be practicing?
So that's a hard question because that's going to vary from state to state. So always check with your state board and see what their requirements are for licensing. In our state, we just have to become facial specialists, but we also have different schooling depending on if people want to be medical esthetician. So you need to really check in your state. But here in Florida, you have to at least be an esthetician to be able to do a dermaplane on anyone.
Are there continuing education classes that you can take, to better your skills? Or
you always want to look for that. Sometimes it's hard to find in person nowadays, but even virtual is okay because at least you can get the technical aspect of it, get the background, get the medical, what the recommendations are, things like that. But always continuing your education is always a good thing, especially for what we do. Things are constantly changing. There's new everything every time you turn around. So always good to have continuing education.
Okay, so this is a two-part question. The do's before a dermaplane, and then the don'ts. The do's and don'ts of dermaplaning. Before, after.
Yeah. So they're kind of the same. Actually, for us, we don't like people to have a lot of sun a week before or a week after. So just think of 7 days before, 7 days after. We don't want people to be using a lot of strong products. So anything with acids, any retinols, any prescriptions that you use topically for the skin, hold off on those for about 3 to 7 days before your treatment, depending on what they are. Again, you'll have to get with your own esthetician to kind of figure out what she wants you to refrain from for those time periods. Everybody's a little different. And it also depends on what products they're using on you during the dermaplane. So there are some things that maybe they don't want to use on you if you've been using certain things beforehand. So always double check with your esthetician before going in so you can figure out what you shouldn't be doing before and after.
We had a question on our last video. Direction of hair growth, which way do you go as far as the blade? That's been a big question that we've been getting lately. So
Yeah.
if you'd like to touch on that.
So I have seen people say go against the grain of the hair. I've seen people say go with the grain of the hair. When I was trained to go in whatever direction you needed to go to be able to get the job done. Mm-hmm. And I understand that from doing this so many years, because of kind of hard getting into certain areas of the face, maybe positioning, maybe your room is set up a specific way so it's harder to get on one side of the bed. It just depends. Maybe the face shape is kind of, hard for you to do a certain area, or under the chin sometimes can be really hard depending on the face shape. So really, whatever is going to work for you to get the job done. I normally myself will try to go against the grain. Sometimes I can't always do that though in some areas, so it just depends. But generally going against the grain is what I would do. But again, I just think whatever it takes to get the job done, as long as you're not overdoing it, as long as you're not overworking the skin and oversensitizing the skin, you should be okay.
How do you tell who can have this treatment and who cannot have this treatment? Is there like a telltale sign? Is there, what kind of things?
So I always ask questions prior to treating a patient. I ask them about their, medications, medical conditions, because of, what we do. We're medical estheticians. I will also ask about sensitivities or allergies, and sometimes you can gauge things that way. But really looking at the skin, seeing what type of condition the skin is in, if there is a lot of breakouts, if there's a lot of inflammation, if there's pustules, if there's a lot of bacteria, then you want to kind of get that taken care of first before you go into Dermaplane. So it really does depend on the condition of the skin and what they have going on. You kind of have to really know what to look for when you're doing these types of treatments too on skin. You have to know what you're looking at, how the skin is reacting, is it handling well? You have to know, when to go forward and when to stop, or when, you've got to be really well trained in that. So the more you do, the more training you get, the more continuing education you get. Find yourself a mentor, someone who has a lot of experience, and somebody you can ask questions to in case something comes up in the treatment room. Something like that. That's always a good idea.
A question for, let's say, a new esthetician. Are there areas of the face that you would recommend to kind of stay in your lane until you really, have a grasp on dermaplaning? Because, you see these videos everywhere and people are dermaplaning every part of every body. So is there a place, as a new esthetician, that you would give advice to?
Yes. Any place you do not feel comfortable doing, don't do it. Number one. If you do not feel comfortable, look at this, I'm doing her ear. If you do not feel comfortable doing that, don't do it. If you don't feel comfortable doing the nose, don't do it. It's hard to get around the mouth area, but let's be realistic. Most women, most people, when they come in to get a dermaplane, they really want that area done, 9 times out of 10. So you do have to at least be able to get around there. But whatever you're super uncomfortable with doing, don't do it. Just get yourself some time, give yourself some time to get used to the basics, and kind of go from there. And don't be afraid to tell people that you don't feel comfortable doing something, or that's not exactly what you do. You're in charge. You're in charge.
I love that. I think we have time for one more question. Is this a treatment that you can do and then do extractions with? Are you able to do extractions with this type of a treatment?
You can. With most skin, you can. Sometimes extractions will happen as you're going over the area with a blade. We have plenty of videos on that, where you're going over a certain area and there's blackheads, and the blackheads just come up with the blade as you're going over the area. But yeah, sometimes it will kind of decap that follicle, so you can go back and you can do a better extraction because you've basically loosened that blackhead up. But don't get crazy with extractions. Don't try and get in there and get, all, handsy and be aggressive and really, don't stop until you get it out. Like, it's okay. It's okay to leave things alone. Yeah. Sometimes things are too deep. Sometimes it's just too much to try and get them out. You're going to, irritate the person. You might even discourage them from getting a facial again because they didn't enjoy it and it was too harsh. They were too uncomfortable. If you can do good treatments on a person and get them on good product, a lot of times that will help loosen things up anyway. We'll see a person and then see them again in 4 weeks, and they'll have gotten started on, basic skincare, and we'll notice they have less blackheads just from using their product at home. So that's going to be something really important to do in combination. All of that together will help.
I love that. Well, I hope this was all helpful to you, ladies and gentlemen. Our time is up, so enjoy the rest of this video. But please, if you haven't already, please make sure you subscribe to our channel and hit that little bell so you know when we've uploaded new videos. Take care, guys. Love ya.
Bye, angels.